We're here with Don Fischer, of course, the voice of IU Sports, IU Basketball, you name it. 4 months ago, just over 4 months, we had the multi-unit hair grafting procedure, didn't we? So what you're looking at here, guys, is the before picture. What you're looking at right here is 4 months post-transplant. When you first notice hair starting to come in?
Well, for a non-patient person, it took a while, but it was about 3 months in, and you started seeing hairline start to fill in. That took away some of the impatience.
Yes.
And obviously it's progressed pretty quickly since then.
What we've kind of got at this point is what we call the framing of the face. So the framing of the face is where you got a hairline again, someone looks at you and goes, you look a little different. And the side profiles, you start to see that reconnection. Right. At 4 months, normally 40 to 50% growth. So you'll get these variations in hair density at this point because all your follicles are at different stages when you transplant them. So they're in different stages of the growing cycle as they come out of that. And it almost looks frizzy at the moment. That's kind of normal because in the early stage of the growing cycle, the hair is a little bit crazy, you know? And that craziness, so to speak, will settle over time.
Gotcha.
You're doing some basic rogaine at home?
Yeah, I do rogaine every night before I go to bed, and I do the laser.
Oh, the little laser device,
the little laser device that you gave me. And
those things aren't prerequisites, guys, but the global approach that we talked about so far as giving the transplanted hair the best growing environment, as well as helping the non-transplanted hair stay healthy and strong. Who knows you've had it done at this point?
My wife.
Yep.
Basically, I mean, nobody else has been told.
So COVID came at a good time, right?
I'm excited about the progress that's been made.
And
it does take a little time.
Yes.
Now it's starting to fill in, and so it's going to be more noticeable. And the people that I haven't seen all summer because of the COVID are going to be surprised at the end.
And how do you feel when you look in the mirror and you start to see a hairline again?
I feel more confident. It looks better. It's going to look really good at some point. I can tell that again. So I'm very pleased.
So this is 4.5 months post-transplant with the multi-unit hair grafting. This is called a trichophytic closure. In the old days, the scar, the suture line that was left, was not very pretty, to say the least. Now it's a pencil-thin line that's really hard to see. Now this will continue to fade over time. And you can see how there's hair growing right back through that suture line. IU Basketball, give us a tip.
Right now it looks like we're going to have a season, so that's the positive.
Awesome.
And if we're going to have a football season, we'll have a basketball season. Both are critical right now to these schools.
Stay on track, come back to the website, follow his VIP page, and we're going to keep tracking this guy as the new hair comes in.
For a free evaluation, call PAI at 888-724-5129 or go to WeGrowHairIndy.com.